One of the devastating side effects of cancer treatment, of course, is hair loss. As chemotherapy drugs kill cancer cells, they also destroy the hair follicles.
Dr. Max Gomez shows us the therapy that helps patients keep their hair and their dignity.
When Dita Reimer was diagnosed with breast cancer last year, she was determined to fight her disease and keep her hair.
Immediately you think, I'm going to be bald, I'm going to be sick.
So Reimer tried an unusual therapy that promised to spare her hair.
This seems like this works, and I just have to give this a shot.
Cynthia Barrett also wanted to save her hair during her breast cancer treatment.
I'm a pretty modest person, but I really felt that I needed to keep my self-esteem.
It's very cold.
Both women used a controversial device called the Penguin Cold Cap. Patients wear a gel cap chilled well below zero before, during, and after chemotherapy. Doctors don't know exactly how it works.
The best hypothesis is that the cold temperature constricts the blood vessels and doesn't allow the chemotherapy to penetrate the scalp and the hair follicles.
The caps are widely used in Europe, but not as popular here.
It tends to be the patients who come to us asking us about the cold caps.
Weill Cornell Medical Center is one of a few hospitals with a special freezer where patients can store their caps.
People describe it as an ice cream headache.
It's very, very, very cold.
It's a complicated process to keep changing the caps to maintain their temperature.
You need a helper to help put the caps on. This process can take 6, 7, 8 hours.
Anecdotal studies show most patients using the caps keep their hair. But Dr. Tessa Sigler says more research is needed. She's conducting an observational study on cold cap use.
We hope to get a sense of how feasible it is to do in a clinical practice, how much effort it is on the part of the patients, and any side effects.
One possible risk is the chance of cancer metastasizing to the scalp.
Cells anywhere in the body might be able to escape the effects of chemotherapy by sort of migrating to the scalp area.
In the future, cooling treatments may be simpler. Researchers in San Francisco and North Carolina are testing a device that continuously pumps coolant to a scalp cap. It's called the DignaCap.
I've had a couple of women very successfully use the cap throughout their chemotherapy and not lose their hair.
Both Dita Reimer and Cynthia Barrett say the risk was worth it.
I succeeded. I won. I saved my life. I saved my hair.
It wasn't so much about the hair. It was about taking charge of side effects and doing something about it.
To help prevent frostbite, patients wrap their heads in protective bandages. Now, doctors say the cold caps are not for all cancer patients. It depends on the type and stage of the cancer, as well as a specific type of chemotherapy, because not all types cause hair loss. Dr. Max Gomez, CBS 2 News.
Cold caps are rented online and cost about $500. The cost, by the way, is not always covered by insurance.